The medical intake volunteer is helping to set the stage for the rest of the visit the patient will have at Clinic with a Heart. Coming to any clinic can be stressful for patients, especially if it is the first time. Patients may not be feeling well, and they probably have a lot of stress in their life. Setting the stage means you are helping the patient to be welcomed and confident about their visit. One of the major roles the intake volunteers play is documenting why the patient is coming to Clinic with a Heart. This may require some interviewing of the patient. Good documentation will help the provider have a productive visit with the patient. The patient or a volunteer and patient have completed paperwork prior to coming to the clinic. This includes demographic, social determinants of health, and health history information. You will be reviewing the paperwork with them and writing in additional insights you gain during the intake. Your notes are important. Prior to intake, all patients have their vital signs taken. Check the vital signs and note on the history form if there are any concerns. For example, if the patient has high blood pressure, note this on the history form. For any patient who is visiting due to a work injury, the online form automatically asks them questions specific to the circumstances of the work injury. We want to have good documentation for the patient should the injury ever require further review. If a patient did have a work injury, we will add information to their chart for them to get at discharge. This includes the worker's rights and the names of good attorneys. Good documentation gives both the provider and discharge volunteer perspective on the patient's condition and circumstances. For example, just writing "needs medication refill" does not tell the provider what kind of health concerns the patient has. Ask questions to better understand the patient's circumstances. How long have they had the condition? Have they been taking their medication? Has anything changed recently? While you're taking the health history, the patient may tell you about a condition that the provider should know about during this visit. Write these issues down under the Reason for Visit section. The patient's medication list will be completed via the online form. Review each medicine with the patient and note if anything was missed. Make sure all sections of the form are reviewed. Make sure the patient has signed the consent to treat, not just a straight line. The intake nurse should also sign as witness. We are able to do quick lab tests at Clinic with a Heart. During your interview with the patient, you may find it helpful to get a lab test done prior to the patient seeing the provider. This helps the provider to have full information before the exam. If the patient needs lab work, write the name of the test on the outside of the chart. We do have the ability to refer patients for other lab services for STD testing and BMP, CMP, and TSH. There are some conditions we do not treat at Clinic with a Heart. If a patient has one of these conditions, please refer them to the appropriate agency and do not admit them to the clinic. If a patient is having a medical emergency, they should get care in the emergency room. If a patient wishes to be treated for a sexually transmitted disease, we are able to give them a voucher for free testing and treatment through the Lincoln-Lancaster County Health Department. If this is the only reason a patient wishes to be seen, they do not need to complete the visit. Contact the referral coordinator to get a voucher. Any patient may get a voucher. We do not do drug testing for Department of Transportation physicals or other types of physicals. These types of tests require special facilities we do not have. Refer patients to CHI Company Care or Madonna for these services. We do not have the lab capabilities for hepatitis testing. Refer the patients to the University of Nebraska Student Health Center. The center is able to provide this test to non-students. Children and adults who need immunization should be referred to the Lincoln-Lancaster County Health Department Immunization Clinic. In addition, adults may be referred to the University of Nebraska Student Health Center. The Lincoln-Lancaster County Health Department has a tuberculosis clinic. If a patient has testing and treatment needs for tuberculosis, refer them to the County Health Department. Our discharge worksheet has a women's health section which lists several options for pregnancy and obstetrical services. Most of our patients who have a positive pregnancy test qualify for presumptive eligibility with Medicaid and can begin getting services quickly. When you have completed the intake, thank the patients. Walk them back to the waiting room, put their chart in the appropriate wall pocket. If the patient needs lab work, put their file in the lab box.